Hello, everybody. It's Tuesday night. It's 7 o'clock, and we are live. Hello, everybody. It's 7:05, and we are live. Welcome to Detox. I'm your host, Veronica Brockwell. I apologize we're a little late. Michael and I had some technical difficulties, but we are here now, and we can't wait to get the show started. So the last Tuesday of every month, our guest is here. Dr. Michael Wild is a chiropractic physician, a functional medicine practitioner, a certified inflammation and detoxification specialist, and he also has a really cool biohack gym and a really cute dog named Ralphie, and we are gonna bring him on to the Detox. Hi, Michael.
Hello again.
How are you?
I am great. Good to be here once again.
Is Ralphie here?
Ralphie decided not to be in my lap at the moment, went to play with his friend Knight, and I'm sure at any time during the broadcast this evening, he will run over and demand to be picked up. So I'm sure we'll be seeing him soon.
And I feel bad because we don't give Knight enough love on the show, but you always have Ralphie on your lap. So
yeah, Knight's quite a bit bigger. He's half Irish Wolfhound, half Border Collie. So when he's in my lap, the show's over.
Exactly. So it's an interesting topic tonight, breathing, because I have a cold. So, but breathing, I know. Can you tell?
Not really. A little bit, maybe.
A little bit, maybe. But breathing is really important, right? We need to breathe.
Well, it's underrated, really.
Right. So I guess before we hop in, just for the new folks to the show, if you can talk a little bit about what you do, that would be fantastic.
Absolutely. And I'll keep it the down and dirty short version. As Veronica mentioned when she first turned on the program tonight, I'm a chiropractic physician, been doing that for about 30 years. I'm a functional medicine practitioner, which I've been doing for about 15 years. And I'm also an avid biohacker. Most people don't know what all those words mean, so I'm going to explain it very quickly. Chiropractic care is about connecting brain to body through the nervous system, so everything can coordinate all the healing, repair, and functions of the body. Functional medicine is about cell-to-cell communication, organ and gland balance, redistributing the systems, the energy of the systems of the body to get your body to work optimally. And then biohacking is using scientific shortcuts to get there as fast as possible, to rapidly improve your health and performance using different tips, tools, and techniques.
And I had the pleasure of visiting your biohack gym last month. What an amazing facility you have.
That was really cool. I was so happy you could come. I'm sorry it wasn't for the best reasons to be in town for some family stuff, but I'm really happy you were there.
Yeah, no, it was fantastic. And if anyone wants to see that video clip, I think, is that on my personal page? What is that? I don't even know, because it was done on
I did load it up to my page.
Okay.
Load it up. I didn't put it on the YouTube channel yet because I didn't do that thing with recording it like I told you I would with Loom. But it is on my business page on Facebook, which is the Facebook link is Dr. Wild Can Help. And the name of my practice is Dr. Wild's Advanced Health Restoration Solutions. So if you search Dr. Wild's Advanced Health Restoration Solutions, you can find it. Or if you go to the Facebook page for Dr. Wild Can Help.
Yeah, maybe we need to do a formal video or something that we can have up, because it was really fascinating when you walked me through all the different options that you have there to have better cellular health,
Yeah, it's very cool.
All right. So we're going to talk about breathing.
We are. Okay. And as I said, it's underrated because it's actually one of the things that we do every moment of every day that we never think about. It's controlled by our autonomic nervous system, which we sometimes call our automatic nervous system because it's that part you don't think about, right? So we have the voluntary part of our nervous system where we might say, I want to point over here or move my arm over there, but we don't think about breathing. We don't think about our heart beating. But the interesting thing about our breathing is we can control it if we want to, right? So we can't really sit here and think, heart, stop beating, stomach stop digesting, that's still under the autonomic control, but we have no control. The breathing apparatus is very interesting because it does it on its own, but we can interject and get in there and do something different, which is really important because most of us don't breathe properly. And the way we breathe automatically is the way we've taught our body to do it. And what I mean by that is like by any habit, the more you do something, the more it's going to become ingrained in a neurologic pathway that your body just takes over. Yeah. But most of us have taught ourselves a very bad breathing habit. And we're going to talk about the benefits of proper breathing tonight and why it's so important, not just for getting air into your body, but breathing properly can change physical deformities of your body, especially of your face, your mouth, your teeth, and even your spine, and can prevent and even reverse diseases.
Well, I'm very interested in this show because I feel like I'm a shallow breather. Like I just don't feel I breathe deeply enough.
And that is very, very common because when we are in a stressed state, we tend to breathe in a very shallow way, right? And when we're relaxed, we tend to breathe more deeply. Now, the interesting thing is, and we're going to get into some details about that the inhalation and exhalation are not equal in what they do for your body. And the exhalation is more important than the inhalation. So we all think, well, I've got to get oxygen in. So it's more important to breathe in. And I should probably breathe in longer and breathe out shorter. And it's actually the opposite. When we breathe out carbon dioxide, which we actually know is a toxic gas. Plants thankfully live on that. So they pick it up and they're kind enough through photosynthesis to make more oxygen for us, right? To breathe back in. Yeah. But carbon dioxide, like everything in the body, it's like the dose determines the poison, so to speak. So too much oxygen is damaging. Not enough carbon dioxide is damaging. And when you have carbon dioxide in your bloodstream longer, carbon dioxide is what triggers the release of oxygen from your blood cells into your tissues and into your other cells. So if you don't have enough carbon dioxide staying in, then you don't get enough oxygen exchange. So your body can be full of oxygen that you can't use. And these are real interesting to me. It's very interesting, especially interesting because you can change it and you can dramatically see improvements in your health over a very short period of time, within a matter of days to weeks. And I want to invite everybody to actually grab this book. Where am I? Breathe by James Nestor. Most of what I'm going to speak about tonight, he covers in this book. And I read about some of the information he gave before, but he does a really good job of tying it together. And we're not going to cover everything in that book tonight. We're going to go over some of the topics I thought were particularly interesting for most people to really start to improve their health right away. And I also used in our promo another little prop, right? A specific kind of tape. And we're going to talk about why this tape can be instrumental in improving your health, improving your quality of sleep, improving or reducing your snoring, and even reducing cavities, which sounds really weird, doesn't it?
Right. I know, but I love these little tidbits you give.
It's a tease.
You do. You give us a little tidbit, and I'm like, oh man, that's cool. You're gonna wait till later for that.
So let's talk a little bit about. You're saying like you've got a cold, so you're having a hard time breathing out of your nose. So you're right now you're primarily what we call a mouth breather, right?
Yeah, right? I would say. Yeah. Now I'll be smiling a lot tonight.
But it's interesting. I don't know if you've ever heard of it. Actually, I'm a fan of Stranger Things. And in Stranger Things, the characters Eleven and Mike talk about bullies or people that they don't like and call them mouth breathers, right? And the reason for that is we traditionally associate a mouth breather as being a derogatory comment for someone that is maybe has a certain slope to their forehead and drags their knuckles on the ground, right? More of a less intelligent, more brute type of person we refer to as a mouth breather, right? But the sad thing is most of us breathe that way. Most of us do not use our nose appropriately. And as a matter of fact, our mouth is not designed for breathing. Our mouth is designed for eating, and exhalation is necessary to speak. So we have to be able to pass air out of it. You cannot speak on an inhalation. Try it. You can't talk. You can only talk when you're breathing out.
Yeah,
right?
I can't do it.
So the breath goes both ways through the mouth.
Yeah.
But breathing through the mouth gives your body much less oxygen than breathing through your nose. Even though the holes here are smaller and this is so much bigger, and you think, I could take in so much more than what I'm doing right there. But
It's true. You think that.
And what
Especially
happens,
like when you're running and stuff.
yeah, right? It gets tough when you're running, when you're exercising, any kind of exercise, right? The typical person breathes about on average 17 breaths per minute. When you're exercising hard, they can go up to 40 breaths per minute. And that's usually right through your mouth. And when you're trying to recover, when you stop, what do? Right? When we breathe through our mouth, we're activating our sympathetic nervous system, which is our fight or flight mode, our gas pedal. It elevates our blood pressure. It elevates our heart rate, right?
Okay.
And we think, well, that must be a good thing if we're trying to do something strenuous. Problem is, when our heart rate goes up, it becomes less efficient. It's beating faster, but it's pumping less blood.
Okay.
All right. So actually, the more controlled your breathing can be, especially when you're under exertion, and the more you can do through your nose, the better quality oxygen you're going to take in. We have septum inside our nose, right? When we have a deviated septum, we might have a broken nose, get a nose job. We also have all these little undulations going up into our sinuses, creating all these little caverns. And on those are all these little hair-like structures that stick out. Sometimes we cut some of them when they stick out, but we have a lot of those in there. There's different cilia. And what they're all doing is the nose is actually preparing the air that you take in for better utilization. So one thing that has to happen is it gets warm. And when we warm the air, we absorb it much better. When we go through all those little convoluted caves that are in there, that has lots of blood vessels and it sucks more air in, and you absorb 20% more oxygen from the air in your nose than you do in your mouth.
Wow.
So you can breathe a lot less and slower and get a lot more oxygen than you do from your mouth. When you're in crisis mode, sympathetic mode, it becomes very, it's like shooting yourself in the foot. You think you're doing better by panting. Like do you know anybody who has asthma?
Oh, yeah.
Right?
Yeah, I know several people.
My brother had severe asthma growing up, and I remember him gasping for air. And was he going, let me breathe slowly through my nose? No. He was, right? He was trying to gasp for air, and it has an actual backwards effect. It actually produces less oxygen in your body, but you're frightened. And when you're frightened, your sympathetic system kicks in. So what you need to do is take control of that. Force yourself, whether you're exercising hard or having an asthma attack, to breathe slowly through your nose. Okay.
You know, this is interesting because I've had that happen where I've tried to breathe. I'm exercising and I feel like I'm not getting enough oxygen.
Right.
Like I can't breathe deep enough to feel satisfied, I guess is the word I'm looking for. Like I'm not satisfied with the oxygen level. Like, I don't know, but it's through my mouth. I know that it is. So
and what's
this
really
makes
interesting,
perfect sense.
Yeah. What's really interesting about that is they did lots of actual studies where they measured blood gases from people breathing through their nose or breathing through their mouth, especially during exertion. And they assumed that the more they breathed, heavier through their mouth, the oxygen levels would go up, and actually they stay the same or they drop. And most people have more than enough oxygen in their body, more than enough oxygen coming into their lungs. They just don't hold it in long enough to let it saturate, get all the way down the lungs into the small tubes called the bronchioles, which then end in a billion alveoli, little air sacs that are actually controlling that oxygen flow into the blood. So one thing that we need to practice is getting air in and holding it in to let that full exchange take place. Then once it does get into our blood, it gets into our red blood cells. It attaches to a protein structure called heme, which is found in hemoglobin, right? And hemoglobin is the boat that carries the oxygen. Now, hemoglobin also is controlled by carbon dioxide. So there's this constant balance. So when the oxygen is there alone, hemoglobin carries it and doesn't let it go. Now, when it gets to a cell that needs that oxygen, it only knows how to let it go if carbon dioxide comes in and releases it. And carbon dioxide only stays in your body if you don't blow it out. So you breathe in and hold it. You're holding the carbon dioxide in. You're allowing the oxygen to get deep, get onto the hemoglobin boat, go to where it's needed in the body, and then the carbon dioxide's still present because you didn't blow it out, to release it and say, okay, go into the cell. So they found that the slower you breathe and through your nose, the more oxygen you got. And it takes a little practice, right? I was doing this myself on the stair climber this morning, trying very purposely to breathe in and out only through my nose and to breathe out 2 to 3 times longer than I was breathing in. Try that when you're working out. That is hard, right?
Sure.
Now, I've been practicing that just as an experiment for the last 3 times I did the stair climber between last week and this week, right? I do it on Tuesdays and Thursdays. And first time I did it, forget it. I was like, that's it, right? Because I was going all out and I couldn't do that. Today, I was able to do it my entire time after just 3 times of doing it. So it just takes a little bit of practice. And I found that I actually felt more energized when I was done. The high points on the stair climber didn't feel so hard to me. Now, I didn't get so much better shape muscle-wise in 3 days, but my oxygen went up, right?
I muted myself. Did you hear me?
Were you coughing or sneezing?
I was coughing.
Oh, I'm sorry.
It's all right, but I didn't want anyone to hear it. I know. I took some medicine, but I didn't want to cancel the show.
Well, thank you for being a trooper.
Hold on, I'm gonna cough one more time.
Okay, you go ahead. I'll keep talking. You go.
Talking. I'm gonna cough.
All right, come back when you're ready. All right, guys, what I was saying was I wasn't in such better shape physically in 3 days, but my oxygen raised, it saturated my cells better. So I was able to get a lot more oxygen where it was needed, which made me felt instantly more energized. And I was able to complete that workout in a much better way. So you do want to practice even when you're not working out, but first start by practicing breathing in for, say, a count of 3 and holding it for about another count of 3, just holding it, and then breathe out for a count of 6 or even 9 or even 12, which is really hard to do. But try it right now. Just practice with me for 1 second. Let's breathe in for a count of 3. Let's hold it for 3, and let's exhale for 6, all from the nose. Okay, ready? Go in. Hold. And out. Hard to get that last bit out, isn't it? Because we're used to forcing it. You want to slow it down, get it out nice and slow. That will enable better oxygen exchange. Now, the next thing I want to talk about is how what we just talked about was known for thousands of years in different cultures. The ancient Chinese spoke about it. As a matter of fact, they talk about the concept of qi, which means life force in ancient Chinese culture. And the practice of acupuncture, for example, is to release the qi to flow better through the channels in your body so your cells have better life force. But another definition of qi in the Chinese culture is breath, because breath is life force. And if you breathe out your nose and in your nose, they call that qi breathing. If you breathe out your mouth and in your mouth, they call it ni qi, which means adverse breath. And ancient Chinese manuscripts, thousands of years old, and ancient Ayurvedic Indian manuscripts, also thousands of years old, both talk about that very same concept, saying that mouth breathing leads to disease. Mouth breathing leads to deformity. And what do I mean by that? Well, lots of really cool research has been done on the fact that the human skull has changed shape over the years from Neanderthal days, right, thousands of years ago, all the way up to the present. And what we have found was that, believe it or not, they had better oral maxillary facial structures thousands and thousands of years ago than we do now. perfect teeth, good, strong jaws. And you look at the average person, the average kid growing up today needs braces, right?
Yeah.
You see that their teeth are crooked, that people have buck teeth. There's overbite, underbite. There's changes to the shape of the jaw. The roof of the mouth tends to fold up. And there's a suture there called the sphenoid that actually starts to push up into your brain cavity when that happens and creates pressure on all the other sutures and creates lots of disruption in your nervous system function, which comes out as varying kinds of illness later in life. So,
and we're saying that's because of not breathing properly. Is that what I missed? Yeah.
That's because of mouth breathing. Mouth breathing creates changes to the structure of your face and your mouth and your jaw and the alignment of your teeth. And orthodontists have done studies on this for many years now, showing that if you take someone with a very dysfunctional oral maxillary structure, crooked teeth, they typically also have, guess who's coming in? Here he is.
Ralphie!
Here he is.
That's awesome.
A little loving. They typically also found that those same children have a lot of nasal congestion and allergies and sinus headaches.
Oh, wow. Okay.
Right? And because of, it's like a chicken or the egg. Thank you, buddy. Right? The mouth breathing can lead to sinus congestion because if you don't use it, you lose it. And the less you breathe out of your nose, the more swollen those sinus cavities become and the more full of fluid they become.
Okay.
Now, when you have a swollen nasal cavity and it's blocked, then you're forced to breathe out your mouth. So it's a cycle, right?
Yeah.
But what you want to try to do is if you're feeling this nasal congestion right now, try to force yourself to breathe out of your nose.
Yeah. Okay.
Best of your ability. And it actually will open up. And they found amazingly when they took a piece of tape and taped their mouths shut.
Stop.
And made them breathe through their nose.
That gives me anxiety.
Their facial structure and their teeth straightened out started straightening out in a matter of 2 months.
You're kidding.
Completely corrected in a matter of a year.
And now a young child.
A young child and adults. You can change as an adult as well.
Really?
Yep. And more so faster in kids, right? Because as they're growing.
So is this at night?
So they did it with the kids more throughout the day as well. Like as much, not when you're eating, obviously, right? But as much as they were able. They said, put a piece of tape over your mouth. Now, you can do it at night, and I've been doing this, and this has been tremendous. I've only been doing this for a couple of weeks, and you don't need a lot of tape. What I have here is 3M transport tape. So air can actually flow through it to your skin a little bit, but it's not so much like you couldn't breathe through it. And you just take a little bit, like all you need is like the size of maybe a little bit bigger than a stamp.
Yeah.
And stick it on. And that's it. Right? Can you understand?
So you do that at night.
Yeah.
All right.
Okay. Because what you simply want to do is, I don't want to do this when I'm sleeping.
Right.
Right? Don't want to catch flies. So you don't have to clamp it shut, but this is just enough to prevent me from opening. So I still have a little air come out the sides, right? And I have put a full piece across, but I find it works just as well with this piece just across the middle. And immediately from the day I started doing that, on average, I would sleep an hour more than I was before.
Really?
Yep. Because I would normally, my internal alarm clock would go off between 5 and 6 usually. And as soon as I started doing that, 7 o'clock. Also, I used to notice sometimes I'd wake up and my mouth would be really dry.
Yeah.
Not ever with that, because you're drying from the air you're drawing in, which is drawing everything out. So I didn't wake up with any dry mouth. I also didn't wake up to go to the bathroom. Right? And as guys get older like I do, and I am, and I'm not going to really admit that, but people tend to have to go to the bathroom more in the middle of the night. Now, going to the bathroom, part of that is all about that carbon dioxide exchange. So when you are breathing through your mouth a lot while you're sleeping, that can lead to things like sleep apnea, because you start kind of choking on your own saliva a little bit, and you start getting these breaks in the air. But what happens is you're not getting a good oxygen carbon dioxide exchange. And when that happens, you start changing the acid alkaline balance of your blood, and you start becoming too acidic. And then what the body does is your kidneys release a hormone to release bicarbonate, right? Like baking soda, to balance your bloodstream. But that also triggers you to go to the bathroom, because that's then flushing and lowering the volume of blood.
Right.
So if you have to go to the bathroom in the middle of the night, it's typically because you have this imbalance of the acid alkaline balance in your blood produced by breathing out through your mouth too much.
Wow.
And so as soon as you're breathing through your nose, you get a much better acid alkaline balance. Your kidneys do not release the angiotensin and renin and other hormones that change your blood pressure, and things that cause a bicarbonate launch, and things that cause you to urinate, right?
Wow.
So that's pretty cool. Now, one more thing that's very interesting is talking about blood pressure. By taping your mouth shut, especially when you sleep, you can lower your blood pressure.
Okay.
Same idea in a sense, right? Because the hormones from the kidneys are controlling your blood pressure. Not only that, but there's a chemical your body creates called nitric oxide. Nitric oxide is responsible for relaxing and widening your blood vessels. So a tight blood vessel has a high blood pressure. A relaxed blood vessel allows more blood to flow, so the pressure drops. So nitric oxide is really important for maintaining blood pressure, amongst other things, in your body. And 90% of your body's nitric oxide is controlled by signals from your nose. It's all based on the oxygen content coming in and the carbon dioxide. So when you're breathing through your nose,
I'm listening to this and I'm thinking all the people that are on lisinopril, because they have their blood vessels are constricting.
Right?
They might just breathe differently and it might control it.
Absolutely.
Oh my goodness.
Absolutely. So there's some simple things. That's why in this
so frustrating, right, Michael? Because
right?
are the cardiologists not understanding? I mean, do they
What
know?
What you say here, right? It's a lost art. They knew this thousands.
Oh, we're frozen, Michael. Michael.
I'm here. Are you back?
Yeah, you're just a little frozen. We're not having a lot of luck tonight. We're not having a lot of luck tonight. And it's such a good show. No, you're good now. You're back.
All right. Yep. A little momentary blip.
I just didn't want to, cancel this show.
Hey, don't hyperventilate about it, okay?
It's so good. I'm learning so much tonight. I do every time we chat, but this is I like this.
Well, it's amazing.
So we were talking about
there are so many ancient healing remedies that doctors today have no knowledge of. And that's primarily because we moved completely into a pharmaceutical-based healthcare system about 100 years ago.
Sure.
And once that happened, all this other stuff got pushed out because the powers that be that paid the bills were relying on drug sales for that.
Yeah.
And so no one wants to talk about the fact that your lifestyle, your habits can dramatically change the health and function of your body.
Yeah.
Right. Now, another interesting thing that I read about in the book there, which as a chiropractor was fascinating to me, he talked about case studies about children with scoliosis, a sideways curvature of the spine that doesn't belong there.
Yeah.
In very serious scoliotic cases where their spine was getting so compressed, it was actually closing in on their heart and lungs. And that's life-threatening.
Sure.
And actually showed that through some, he calls them pulmonauts, like astronauts exploring breathing and lungs, pulmonauts, right? And one of the early pulmonauts in the 1800s developed breathing techniques where he would work on relaxing the muscles between the ribs and have you do this different kinds of slow, deep breathing. and saw scoliosis completely correct themselves, which is unheard of.
Wow.
Right? And not only that, later pulmonauts, even just 10, 20 years ago, trained athletes, especially those who were considered asthmatic. There are athletes who are asthmatic, and these guys are trying to, get to the Olympics, and they're having asthma attacks, and he taught them how to breathe properly, and their asthma attacks stopped. Not only that, for the first time in history, like the U.S. Swim team won like 13 golds and 8 silvers and all stuff, all based on changing their breathing. And what that particular trainer did was the average swimmer takes 3 strokes and then breathes, 3 strokes and then breathes. He had them go 9 strokes before breathing, forcing them to hold their breath, which gave them actually more oxygen to use in their cells, which gave them more energy. So by the time they took another stroke, it was exponentially more powerful than their competitor. And we swept the medals, right? So it's really amazing to realize that, breathing less is better than breathing more. I often talk about that when I talk about intermittent fasting, and I talk about eating less and how important it is to eat less than we do. And here it is, breathing less is just as important, if not more, right? So the old less is more approach, right? It has fundamentals in ancient manuscript truth from thousands and thousands of years ago. Now, talking about breathing out the nose, we see that that's actually a better thing to do than the mouth. Right. But there's ancient Hindu practices and yogi practices that talk about breathing from one side of your nose versus the other side of your nose.
All right.
And each nostril controls different parts of your brain. So they both send signals to what's called the prefrontal cortex, but different parts of that prefrontal cortex. Now, the left nostril.
Is this in everyone?
In everyone.
Okay. Left or right-handed? It does not matter. Okay.
Your left nostril controls that sympathetic gas pedal system in your body, revs everything up, fight or flight. Did I say left? I'm sorry. That's the right nostril. The left nostril is the opposite. The left nostril is parasympathetic, which is the brake pedal, slow everything down, rest and repair, right?
So should you go like this when you want to calm down, push your right one in? Is that what you're supposed to do?
Exactly, right? So if you want to, when you stimulate the sympathetic system, close the left side and only breathe out of the right, that activates the sympathetic system, which raises your heart rate, raises your blood pressure just a little bit by doing that. But
why would you want to do that?
Because it activates the prefrontal cortex section that focuses on logic and clarity of thought.
Okay.
So if you need to make a big decision, breathe out of the right side of your nose.
Push, block off the left side.
Right. Well, let me think about that for a minute. All right.
I know, because we're looking.
Right.
And I have a cold, so if something happens here, I apologize in advance.
Now the other side, right? Close off your left side.
Yeah.
Close off your right side. Good Lord. I'm getting confused. I know. I'm looking at myself as an opposite, so I keep saying.
Yeah, that's why I said. So this is my right. This is my right side.
Close off the right side and breathe out of the left side.
Please,
that activates the other part.
Keep it clean.
That activates the other part of the prefrontal cortex, which is your creative thinking area.
Yes.
Also helps you to relax and go to sleep.
So if you want to sleep at night, would that be something good to do? An exercise?
Right. So tape your mouth shut to begin with.
Yeah.
Now, if you're laying there counting sheep and you can't fall asleep, close the right nostril and only breathe in out of your left. And it'll activate your relaxation response and initiate a release of melatonin, which is a hormone that controls, in large part, the initiation of your falling asleep cycle. Melatonin is involved with a lot of things in your body, including controlling cancer and stopping metastasis. But also, we think of it as our sleep hormone. Okay? So it's interesting, if you're having trouble digesting, even though the parasympathetic nervous system is also known as the rest and digest system, If you're having a particularly tough time, like, hey, I'm suddenly like, I have pain in my stomach, I'm burping a lot, I'm farting a lot, breathe out of the right nostril. It actually activates digestion. It gets it kind of fired up a little bit. So I thought that was particularly interesting. So the yogis practice something called alternate nostril breathing. And they talk about breathing 12 times in and out of one nostril, and 12 times in and out of the other nostril, and then 12 times in and out of both. And when you do that, you're rebalancing your nervous system. You're balancing that fight or flight and that rest and repair to maintain a new homeostasis so your body can actually function optimally with a combination of creative ideas and clear thought, optimal digestion, good blood pressure, good heart rate. That comes from balancing your breathing.
All right.
Interesting, right?
I'm fascinated by this whole thing. I'm a little nervous about taping my mouth shut.
Well, I can understand why you would be.
Yeah. I try this. I'm not during the day. Mike, can you imagine?
It's a lot easier than you think. I didn't know what it was going to be like.
I don't know.
And I had no problem. I actually felt more content sleeping. Okay. I just felt more relaxed. And the other night, I forgot to put it on, and I had a horrible night's sleep. I tossed and turned all night, and I don't know if it was coincidence, but my mouth got really dry. I had to go up and use the bathroom twice, right? So I thought that's really weird because I don't ever even normally do that,
Yeah.
So I noticed a distinct difference for the first day I've been doing it for about 2 weeks. For the first day I forgot it, dramatic difference in my sleep pattern from every other night.
And did you find the first night awkward or?
Not at all. I actually fell right to sleep and slept soundly. I woke up an hour later going, holy cow, an hour later than usual. Instead of 6 or 7 going, how's it 7 o'clock already? I never sleep that late,
Okay.
So that was interesting.
So are you going to go over different breathing methods?
I am. I'm going to tell you one more interesting tidbit that might get us blocked on Facebook again, because I'm going to talk about erectile tissue.
Oh, no. This is not, we're going to go off again. All right, let's go. Let's just bring it on. It doesn't matter.
So that nitric oxide that nose controls dilation of blood vessels.
Okay.
So anything on a man or a woman that's having trouble with arousal, breathing through your nose fixes that.
Okay.
All right. So
all right, folks,
you may wake up feeling tingly.
You heard it here.
All over.
Tape your mouth shut. This is getting weird.
Right. I'm going to leave up to your imagination where you go from there. You can use tape. You can use whatever you want to tie up with. You're okay.
Yeah, whatever you want to use.
I thought that was really interesting because there's erectile tissue in your nose. That's what causes that swelling of your sinuses when your nose gets congested. It's actually erectile tissue, right? Just like we have in other parts of our body, both men and women, right? And I'll leave it to your imagination, but think about what happens when you walk outside and you're not wearing enough clothes and it's cold.
Right.
Okay.
Right.
So that's also why asthmatics have a hard time breathing when it's cold. They need to warm the air. The nose, the erectile tissue will actually puff up a little bit. It gets a little harder to breathe out of your nose when it's cold out.
Okay.
And you start going to mouth breathing, and asthmatics then tend to put a scarf around their mouth to try to warm the air, because then it gets in better because their nose can't really do it. So it's just interesting little things you don't really think about that all ties together.
What about, I remember when I was young, what about they used to call it swimmer's lung. But,
swimmer's lung?
Yeah, you'd feel like your lungs would almost hurt. And a lot of people would have it from swimming. Does that sound familiar?
Did you drink the chlorine?
No, I was a little kid. It's like an old school term. gosh, if anybody's out there knows what I'm talking about.
So I'm not familiar with that term. I don't remember ever hearing swimmer's lung when I grew up.
Yeah, you'd go swim a lot and then you'd get this like feeling in your lung, like in your chest.
So I know that when I've swum real hard, I could feel like a pain in my lungs, it feels like.
Yeah, I mean,
Yeah.
a lot of kids would feel it. They would talk about it, and I think it was called swimmer's lung. What causes that?
So I don't honestly know. I can hypothesize because I'm not familiar with that term.
I know. It just popped into my head. I hadn't had it in a long time.
But
Yeah.
I would guess when you were swimming as a kid,
Yeah.
were you taking the time to slowly breathe out of your nose while you were swimming? Or were you going,
Yeah, probably.
right?
Yeah.
And the more you gasp for air, the less oxygen exchange happens in the lungs and the harder you're asking to work against the force of the water. So I would think that your chest muscles would actually hurt more because you're working much more forcefully to try to expand and contract because you weren't really getting the oxygen in that you thought you were.
Okay. All right.
That's my best guess.
All right, that works.
So
sounds good to me.
breathing techniques, and while I was on, I actually taught everybody one, and we went through it.
While I was coughing.
While you were coughing, right?
Well, I got honey because that helps. It coats my throat.
What'd you use?
Just some honey, so I wasn't sucking on a lozenge. Yep, yeah.
Okay.
So yeah, it was something quick I grabbed.
Absolutely.
I know it's sugar, but I was just
if you get Manuka honey from New Zealand, right?
Yes.
Which you can buy in many stores, and we have in Trader Joe's around us and different stores. Manuka honey has very strong antibacterial and antiviral properties.
Yeah.
You can actually use it on a cut like you would bacitracin. Right?
Yeah.
Mm-hmm. But if you use that actually helps if there is an irritant, like a virus irritating the tissues, it can help kill it.
Yeah.
So better to choose Manuka honey than regular honey, whatever that is.
Yeah, it says it's organic, but who knows? That's a whole nother show. I think we even had that show.
True. So let's talk a little bit more about breathing techniques, right? So before I told everybody about was breathing out longer than you breathe in. Try to breathe out at least twice as long as you breathe in, and actually breathe in, hold it for just as long as you breathe in, like breathe in for 3, hold it for 3, breathe out for 6. It's actually a lot harder than you think it is. The breathing out part, by the time you get to 4, you feel like all the air is gone, but keep pushing, get rid of it. Another technique.
But also, I guess what my question is, are we supposed to be doing this just completely change the way we breathe, basically, or these exercises?
Practice exercise. What happens is you start to teach yourself a new habit, and then you start doing it somewhat unconsciously. Right?
So do you breathe this way all the time now?
No, I'm working on teaching myself it.
But that's the goal for you.
But that's the goal. That would be the goal. Right?
Okay.
So what you want to do is realize, hey, I'm breathing a lot less than I used to. So when I look at the studies, I said how the average person breathes 17 breaths a minute, up to around 40 to 45 when you're pushing hard. Well, what the researchers have found is the maximum perfect cadence for breathing, oxygen exchange, full utilization, carbon dioxide exchange is 5.5 to 6 seconds in and 5.5 to 6 seconds out. We'll give her a second. And she's back. That's okay. One more. Okay. So when you do that, it's very interesting that 5.5 seconds in and 5.5 seconds out altogether equals 5.5 breaths per minute. Way less than 17, way less than 40. Can you hear me talking when you're coughing?
Yes, I have.
Okay.
Yeah, I just muted so you guys didn't have to.
Okay. So you heard what I was saying. It's kind of like a magic number. So they found that 5.5 seconds in, I just round up to 6, a lot easier, right? But 5.5 in and 5.5 out equals 5.5 breaths per minute. And that seems to be the exact perfect ratio. As a matter of fact, when they went back and looked at breathing practices of all various societies around the world over the centuries, they found that ancient monk chanting followed that exact pattern. The Catholic reading of the rosary and saying a prayer for every bead follows that exact pattern. And when you do these things, it dramatically changes not just your state of calmness, but it normalizes your blood sugar, normalizes your blood pressure, normalizes heart arrhythmias, gets rid of headaches, stops insomnia, helps in the bedroom, increases muscle strength and activity. So many benefits from this, it's not even funny. And I said earlier, I alluded to it even cuts back on cavities, because I found that there's a normal balance of bacteria in your mouth, just like there is up your nose, just like there is on your skin, just like there is in your gut, just like there is on your genitals. We have these different microbiomes, or little microcosms, little universes of different organisms that have different purposes, and they're different in these different areas. The ones in our mouth serve many purposes. They help to break down our food. They help to control the bad bacteria, right? It's called competitive inhibition. It's like spiders and flies. So you have enough of one to control the other. And when we have a good balance of bacteria in our mouth, it protects our brain from developing dementia in large part, protects our heart from developing valve defects, leading to heart attacks like what killed my dad, right? I know you remember we spoke about that on a long ago episode, but my dad had heart valve defects caused by a tooth infection from the bacteria in his teeth that traveled to his heart and caused a valve defect, which then led to surgery for that, which then led to a problem with an arrhythmia, which then led to a heart attack, right? All within a short period of time. So they've also found that the bacteria that produce the acidic chemicals that eat your enamel away and cause cavities are mainly aerobic bacteria that thrive on air coming in. And the more you breathe through your mouth, the more that population grows. The more you shut your mouth when you sleep, the less that population grows, and reduced cavities by 90%. That's crazy to me.
It really is. It really is. You know, I'm totally going to try this, just not
Absolutely.
today.
Right. And I look at,
yeah, totally.
I have one of my patients who I take care of her and her whole family and her little kids. And the littlest one, she is 4, 5. She came in and said, always came back from the dentist. That was not a good appointment. And I said, what are you talking about? She has 10 cavities. This little one, right?
Oh
and she said, I don't understand why the whole family eats the same thing, right? And it's not like we're having an abundance of sugar. As a matter of fact, sugar does not cause cavities, but sugar does feed the same bacteria that produce the acid that eats your enamel away.
Okay.
And better nutrient density prevents that, rebalances that. So dentists have found for years in studying cultures that the right nutrient density prevents cavities. And you could pile the sugar in and it wouldn't make a difference. Not that I'm saying that anyone should do that, right? But that's what they found.
If you've watched the other shows, we don't do that.
Right. We don't do it for other reasons,
No.
right?
Yeah.
But sugar does not cause cavities, but sugar does feed the bacteria that cause cavities. And breathing through your mouth feeds the bacteria that causes cavities.
Okay.
So the more you breathe through your nose, the less cavities you'll have.
Wow.
So let's talk one more time for a second about a breathing technique. So there's many different techniques. Some of the more famous ones is one called the Buteyko method, Buteyko. He was a Russian scientist who found that if you really delay the exhalation, that has tremendous benefits. So that whole slow exhale is more his thing. There's another thing called box breathing. Breathe in, hold it for the same amount, breathe out, hold it for the same amount. So in for 5, hold for 5, out for 5, hold for 5, in for 5, out for 5, hold for 5. So just practicing that for a moment really brings it in slow, holds it, oxygen exchange, out slow, holds it, oxygen exchange, right? So we're getting twice as much oxygen to our cells when we do that.
Right.
So when I meditate, that's what I try to practice, is box breathing through my nose only. So I'll be listening to a guided meditation because I find it helps me to have guidance to say, now think about this, let's envision this, let's relax this muscle. It's easier because otherwise your brain starts wandering, right? And I use a specific software program when I meditate. Same when I use my office, I put on those headphones you were listening to when you were on my hydro massage table. It's called Brain FM, which stands for frequency modulation. And they are the only program found to introduce sound waves in such a way using 3D spatiation. So it sounds like the sounds are going around in the music in your head when you're wearing this. That's designed very specifically to take your brain from a high state of arousal to a deep state of relaxation and healing in just 5 minutes. And normally that would take hours to do.
That was fascinating.
Right? And how relaxed did you feel when you got 15 minutes off my table?
Yeah, it was amazing. And it was not what I expected, like I thought I was gonna listen to relaxing music like you listen to at the spa. It was not like that at all.
Right. And
it was fascinating. It was so interesting. It felt great.
I can use different brainwave music. You're welcome. I'm glad you get to do it. But you can use different patterns to enhance your focus or to help you meditate or to fall asleep or to stay asleep. These are all different brainwave frequencies. And within this software, you can modulate all that, right? Which is really, really cool. I don't have it handy, but it's not expensive. I mean, you guys can get this as a software program on your phone, put headphones on, do this yourself. I'll send you a link. Maybe you can put in the show notes, but I have a link. I think it's a discount for that.
Okay. This was the Brain FM.
Yeah. So with the discount,
it's an app.
It's an app, or you can go to their website too. I think you can get it for like $45 for like a year.
Oh yeah, that's great.
Right?
Yeah.
So I don't see any reason why someone wouldn't do that.
Right.
And I'm listening to the meditation with those brainwave frequencies while doing this breathing, and I do it for 15 minutes. And I do it the first thing I do when I wake up. I have my headphones right over my head, hanging on my bed frame. I pull them down, and I do this before I step foot out of the bed. And that focuses my mind and my body on a great start to a great day, right?
Right.
Everything's in balance, and I'm ready to go.
Yeah. I thought it was fascinating. I also liked that room with the red light.
Yeah, that was pretty cool too, wasn't it? Right?
Yeah.
So I have various red light therapeutic tools to optimize your healing repair, melt your fat, increase collagen, reduce wrinkles, flush the toxins out of your cells, deep tissue and joint repair, enhance your testosterone production, because our cells respond to energy, whether it be light wavelengths or sound wavelengths. Having the right frequency and the right modulation makes all the difference.
Exactly. Anything else on breathing? We're coming up to the top of the hour.
I think that's probably good enough for this episode. If you'd like to talk more about this, we can do a part 2. And I could talk about this. Everything I talk about tonight is in the first half of that book for the most part. So we could talk about stuff in the second half if you want to continue another time. But I think that pretty much wraps up what we want to talk about tonight.
I think, I really loved that live that we did in, your gym, zone. I think it would be cool to have a whole show like that.
Absolutely.
We just have to figure out how to do it. But I'd like for our viewers to experience that instead of just doing a live on Facebook,
Right.
So I think we should do that because I found it so interesting.
Going room by room and talking about what the tools do for you. And if you can't come to Richmond, Virginia, I can also show you, well, here's the second best thing you can do at home.
Great idea. I love the idea. Sure.
So,
or franchise opportunities.
Well, that's my ultimate goal, because really, I would love so many people around the country, around the world, to have access to this technology. And just recently, Forbes magazine did an article all about the rise in biohacking gyms popping up all over the country, especially in places like New York City, Los Angeles, Beverly Hills. Dave Asprey, the founding father of the term biohacking, opened his own facilities, and he has his own franchise. If you want to buy into it, it's only $1 million to start.
Only dollars.
Only $1 million, right? Now going and spending a day.
It's it's all the equipment and everything that you would need, right? Yeah.
And going and spending a day in his gym and using his equipment in Beverly Hills would cost you $250 for a day pass. Come to mine, $47. Right?
47?
Yep. So I have a day pass. You can use every single piece of equipment I have and spend 2.5 hours there, and $47.
You know, I'm going to be there on Saturday.
I didn't know that.
Yeah, I'm coming for a few days. I'm not leaving until Tuesday. Can I come play?
Yes, you can. Of course you can.
Anybody
who's local in Richmond, there's 4 rooms in my biohacking gym. It's called the Biohack Zone. It's a cellular health spa or gym. There's 4 rooms, one devoted to reducing your stress, both for your body and mind, and optimizing your healing. One for increasing your strength, both muscularly and cardiovascularly. And we can give you the equivalent of 2 hours in the gym in under 20 minutes with the same biochemical effect. We have one room for...
That was the shaking thing.
So that was part of it. So if you did the resistance
and
exercise...
then the bike. What was the bike?
And that special bike. Very, very special bike. Actually, Forbes spoke specifically about that bike. So I was all excited because I was like, hey, they mentioned 5 pieces of equipment. 3 of those I have in my space. Right?
What was the name of the bike? The lady
called Carol.
Carol, yeah.
Which stands for Cardiovascular Optimization Logic.
Right. Yeah.
Right. The smartest smart bike there is. Very, very cool stuff.
But while you're on it, you have to keep your mouth shut.
Exactly. And
you tape our mouths shut when we get on Carol.
Well, I could, but I'd have to use duct tape to really get you to keep it shut, because you could bust this tape open at any second. It's just a gentle reminder. Right.
Yeah.
We have one more room for enhancing your detoxification and microcirculation. It dramatically improves blood flow through your capillaries to your limbs, your hands, your feet, your organs, and your brain. Fantastic. And one that really goes deep and flushes toxins out of your cells using infrared sauna wraps. Mm-hmm. So we wrap you up like a giant burrito, and it's extremely efficient. 20 minutes in there is equal to an hour in a regular sauna. And then we have that last room called Optimizing Appearance that you just spoke about, all different red light therapies and amber light therapies and different wavelengths. And then we also combine the vibration platform in there for certain purposes and see dramatic results in before and after for people.
Yeah, I'm definitely going to be there. Just tell me, what are you open Monday?
So Saturday, we're there from 9 to 1.
I'll be traveling that day.
Okay. And Monday through Friday, we're 9 to 7.
All right. Monday morning.
All right.
I'll have to make an appointment.
So you can just show up if you want to, and I'll fit you in on whatever's not being used at the moment.
Okay.
But that's the easiest thing to do. Otherwise, you're going to have to know all the ins and outs of how to schedule for different pieces of equipment.
I'm going to be there on Monday. I
all right,
totally
cool.
am. Okay.
I'll be there too.
Yay. All right. What else you got? We are wrapping it up.
I think I have a big good night.
Oh, buddy.
He's got eyes in there somewhere. I swear he does. There's one.
Aww,
right?
I love Ralphie. He's so cute. How old is Ralphie?
Ralphie is 7, going on 8. He'll be 8 in
Look at this dog.
January-ish.
I can't. So cute. All right, my friend. I'll see you Monday.
All right. That sounds
and really everyone else will see you next month. But maybe I'll shoot some videos while I'm there.
Let's do it.
Let's do something fun. All right.
We'll figure it out.
All right, honey. Thanks for being, I know, I'm so sorry I was coughing. I know I couldn't help it, but.
Hey, it happens. That's okay.
But you could have handled the show alone. So I just sit here and go, okay.
Well, I always, I appreciate the opportunity for you to allow me to spew forth my verbal diarrhea. If I could just, I'll end with
we love it. It's the, best stomach ache around. I don't know. It's great.
Well, I'll end with a little brief anecdote about this weekend. My son got married. right?
Oh, congratulations.
Yeah,
Yes.
it was wonderful. Truly wonderful. Beautiful weather, outdoor ceremony. Everything was beautiful, except I screwed up.
He
I
has
had
your
prepared,
smile.
well, I had prepared a toast, which with my verbal diarrhea quickly turned into an essay, which turned into a novella. It was only 6 pages long,
Okay.
right? And I knew that I could actually speak that in 7 minutes, right? So that's the toast I prepared because there were some things I thought were really important that I wanted to impart to my son and his new bride on their wedding day.
Uh-huh.
And at the wedding, I said to him, "Hey, we never spoke about this, but I want to give a toast. When's a good time to do that?" And he said, "Last night at the rehearsal dinner, that was your turn. Tonight is her dad. You blew it. You missed it. You don't get to give a toast now." So he said, "We're on a tight schedule. We have her dad, we have the maid of honor, and he had twin brothers as his best men, and they're both giving speeches." He said, "And they're each of them are allowed a minute and a half to give a toast." So I said, "Well, then you've got a problem because I'm still giving a toast." Right? So I went to the wedding coordinator and she said, "Well, when the last best man goes, I'll have him hand off it to you with the mic and you just go as fast as you can." So I quickly ran over, grabbed the pen and scribbled out half of my toast and condensed it down to the real meat and potatoes. And I did it in about 3.5 minutes.
Oh,
I think I was
congratulations.
probably mouth breathing as I was trying to get that one done.
Oh, that's great. Yeah, I saw the pictures on social media. You guys look so similar. It's amazing.
Except he has hair and it's dark.
Okay. All right, my friend. Go cough. A lot. And then I'm going to see you Monday. All right.
We're out.
All right. All right. Thank you.
Okay. Have a great night.
All right. You too. Bye.
Bye-bye.
All righty, everybody. Thank you so much for tuning in and being so patient with my little cold that I have tonight. But I will be seeing Michael Wild on Monday now, and I'll be in his gym. So maybe I can take some videos and put something together so you can see what he does there. And if you are interested in working with Michael, he will work with you virtually. I actually, I've known him for a while, but I actually just personally met him last month. So he's been my doctor online and through phone calls and mailing me tests, things like that. And it's worked out great. So you can go to the site. It's on the ticker, drwildcanhelp.com. And you will see a button that says free consultation. Click on that and make an appointment and you get a free consult with him. He has lots and lots of tests that you can take that will individualize your healthcare in a holistic way. He's fabulous. So anyway, I'm going to go sign off and maybe I'll go to bed early because I'm sick. All right. Take care, everybody. And thanks for tuning in. Bye-bye.